Dr. Oz is under fire from Democrats over a controversial Medicare plan that could affect millions of seniors. Here's what's happening. The CMS, led by Dr. Mehmet Oz, wants to test prior authorization requirements in traditional Medicare starting next year across 6 states: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. That means patients would need insurance approval before getting certain treatments like knee surgeries, skin grafts, and tissue substitutes. But here's where it gets concerning. The government plans to contract with private companies to actually run these authorizations. And these companies get paid by keeping a share of whatever money they save by denying care. Talk about a conflict of interest. So what did the Democrats do? 17 House Democrats, led by Reps Susan Delbin and Ami Bera, wrote a formal letter to Dr. Oz on Monday demanding answers. In their letter, they said, quote, "The use of prior authorization in Medicare Advantage shows us that this will likely limit beneficiaries' access to care, increase burden on our already overburdened healthcare workforce, and create perverse incentives to put profit over patients." The Democrats are specifically asking Oz to explain how the pilot will work, what services will need approval, how care requests will be reviewed, and how they plan to avoid improper denials. And they have good reason to be concerned. When Medicare Advantage plans used similar rules, a government report found that 75% of their denials were later overturned on appeal. That means 3 out of 4 denials were wrong. The Democrats also pointed out that providers in these 6 states won't have a choice about participating. It's mandatory, creating what they call an involuntary burden. Traditional Medicare currently only requires prior authorization in rare cases, so this represents a major shift. They're demanding Dr. Oz respond by the beginning of September. This affects traditional Medicare, something millions of seniors rely on for straightforward, uncomplicated coverage. What do you think? Should Medicare require more pre-approvals when most denials get overturned anyway? Drop your thoughts below and follow for more healthcare updates.